10 Minutes to Your Health, and we do it on Thursdays, and we are joined by, and I got it right, an iridologist, and it's Dr. Vinola Robinson Fowler. And even though I say Dr. Fowler, you're not a medical doctor.
That's right.
You're a PhD doctor,
yes.
And you're not trying to say you're a medical doctor.
You got it.
Iridology is what?
Studying the iris of the eye. The iris is the colored part of the eye. And the iris is connected to the organs and the tissues by nerve endings and the meridians. And the iris actually is a camera. Like that camera picks me up now. And it's the extension of the brain. So everything from your emotion to everything that's ever happened to you is recorded in the eye.
Where did this come from? Where did
it started in 1800 with Ignat von Pestley. As a young man, he interfered with an owl's nest, and the owl, of course, is going to defend his ear. So he struggled and broke the owl's leg. And immediately, eye and eye contact, he noticed that there was a line, a direct line where the breakage was. But he didn't understand it then. When he became a physician, a surgeon, over the years, he began to study the irids of his patient's eye before and after surgery. And he came to the conclusion there was a direct link with the iris and the body organs, because after surgery, there was a difference in the iris of the eye.
We just saw you having a look at one of our production assistants, Andrew.
Yes.
What did you find out about him? Could you tell that he was an absolute idiot after you looked in his eye?
Not really, but
not
I was
really,
able...
but close to.
No, not even close to. I was able to analyze his condition without asking him any questions.
All right, you use the word analyze. So in a serious way, can you look at my eyes now and say whether I am...
If I had a flashlight and I could get close to your eye, yes, I'd be able to analyze a few. But at my office, I have a Nikon slit lamp, and that is a magnifier, microscope, and that picks it up greatly, and then it sees it right on the television, and I'm able to analyze it.
So what do you see? What if I had... all right, here's a flashlight. So
okay, you want to demonstrate?
Yeah. So
now you know I don't have...
First thing.
Don't say nothing personal.
If anything wrong with me, don't
say.
The people then.
You got it. Right. No.
So the iris now, come in close, because the iris is where?
The iris is the colored part.
The colored part, which is right in the middle of my eye.
Right, and you have a light brown eye.
Okay.
Yes, so you are a mixed eye.
I have a beautiful...
Okay, you have a beautiful, sexy eye. That sounds even better.
Me love it.
You got it.
No, me love iridology already.
You love it already?
Yeah.
Okay. In looking at this, I know that you have had a damage to the middle of your back. There's a weakness there. In looking again, I also know that this left leg has a weakness.
Well, I don't have a weakness you find about me already.
And you have a cramp in the leg and a weakness.
Look somewhere where you say me look good or
okay, me say you look good. Me say
right.
you look good. Me say you look good. You love fried food and greasy food because your cholesterol is showing.
I know why
you don't want to say nothing more.
It is amazing that you say that, because I was born in a serious way with a twisted spine, and I'm told that I do have scoliosis, so I do have a back problem. Yes, it showed us
in the lower back.
And the last time I did a cholesterol test, they told me that it was high.
Yes.
And you just saw that.
Yes, it is.
That's absolutely amazing. Well, that's true about me, and that wasn't staged, by the way, folks, because it's the first time I'm even talking about iridology. Treatment?
Herbology and herbs and nutrition and exercise.
I said at the start that you are a PhD, so you're not a medical doctor. How are you looked at in the medical profession? I would imagine that some of them might think you're a bit of a quack.
Yes, and some have shown great respect for my discipline, and I'm sure for some I'm probably a great nightmare.
You said analyze just now, but actually that was a bit of a diagnosis that you did, wasn't it?
Well, because conventional medicine uses the word diagnosis, and how I was trained. I'm not a medical doctor, so we avoid certain wordings. So because in the eye, I'm only analyzing actually what has happened to your body. And when you come to me, I don't ask you any questions except your age, your blood type, and children you may have, and the work situation, because if you're a sit-down person, I'm looking for certain things.
Just now, and again in a serious way, you said I had a back problem, so
yes,
what would you then tell me after that? That I must go see a doctor, or is you going to cure it?
Well, no, God cures. What I do, I ask you to continue seeing your medical doctor. And after a 90-day program, because I say, give me 90 days to make a difference, I say, go and get a checkup. Because I say, your mid-back, your lumbar spine juts out, it curves out, which would affect your left hip and your leg.
But then if you're going to send me to a medical doctor, why should I come to you in the first place?
No, I didn't say send to a medical doctor. I said continue with your medical doctor.
Okay.
Because, you know, you need blood works, etc. And whatever problem you arrive with, we work on that problem. Okay. We do hydrotherapy, we do poultices as well, and we do naprapathy, which is just shifting the muscle as I work with it. So you can call it a different therapy, and that will help to realign the spine. Now, because you have had this problem for a long time, I can't promise you that your spine is going to be straight. That would be ridiculous. I can suggest to you that a change in diet, maintain this weight don't look so bad, certain types of exercise, and how you walk. Now, most people step off on the right leg, but you step off on your left leg, you know, because the circulation of the blood. Left, right, left, right.
Yeah, no, hold on.
If you walk on your left, you're in alignment.
Wait, no, man, work with me, Dico.
Okay, step off and go ahead, step off now.
I just want to see what I would do. Yeah,
left,
step
right.
off from my left leg, yeah?
Step off on your left. You always step off on your left.
So what if I step off on my right?
You step off on your right, so you get lower back pain. You may go to the same place, but you have less strain on your back.
If I step off on my right, I have less strain.
No, you have more strain on your back.
So
okay, watch me then. Watch me.
No, because you're
you don't want to watch me.
Okay. Well, stand up if you're not going too far. Yeah.
Oh, no, can't go too far.
You can, yeah. And what you saying now?
Okay. If I step off on my left, watch me.
Don't go too far.
Left,
yeah?
right.
Yeah.
I can come back with my left, right in alignment.
Yeah.
Watch me now. I step off with my right foot. Right, left. You saw me back twist? You notice the twist? Yes, you did. Watch again.
Hold on, watch me. So if you say, if I go right, left. Then what I do? If I come back funny?
Yes.
And then if I go
you
left.
See, listen, the circulation is left, right, you know, is that right, left? You know, so the soldier can walk for miles and never get too tired.
Okay, I'm going left, right, left,
you
right,
got
left,
it.
right.
You got it. He's in alignment.
Hold on, man. Let me not go to the same place. I may not reach the same time if I step off.
Yeah, but you're more tired than him. He's fine. He's not breathing short.
I am not breathing short.
Because you don't walk yet.
Oh. Are you the only iridologist in Jamaica?
I doubt it very much, but I think, I know I am the first that brought iridology here in Jamaica. I know that.
Okay, you're having a forum coming up.
Yep.
Iris analysis, it says.
Yes.
When is it?
It is November 11th.
Where is it?
Altamont Court.
What kind of money is it?
I think it says it there, $5,000.
$5,000.
Yes.
And this will do what? Just inform?
Not only I will inform them. For the first time, they will understand what iridology is all about, and all the misconceptions will be abated.
Okay.
And for the first time, they can ask me all the questions they want to.
Okay.
And I'll introduce to them my nutritional approach, the booklet that they get, the diet booklet that they get, etc., and also gourmet vegetarian food that my daughter does.
Okay. You looked in my left eye. In a serious way, had you looked in my right eye, would
There's
you
a
have
difference.
seen the same thing?
There's a difference. The left eye tells me about the left body. No, he want me to tell him about the right body.
Yeah.
And the right eye tell me about the right body.
Yeah.
Okay?
You turn that one, yeah.
Okay. There we go. I'm going to whisper.
Let me get worse, all right? Hold on, man. Right time you done me drop down before the show face. I do not want to hear.
You don't want me to tell you?
Well, you got one thing wrong.
What's that
You
wrong?
got the back right, you got the left side right, but I don't eat fried and greasy foods.
Well, the cholesterol come from refined foods. You're probably not eating fried and greasy food at this time, because you've got knowledge on it. But prior to, I'm sure you did.
So you saw that my cholesterol is high?
Cholesterol is high. If my naked eye can see the cholesterol level, it's high. However, my level is lower than conventional medicine.
You don't say
because when you get to a certain age, your liver automatically makes cholesterol. So when I get you, I try to keep it below average. So as you get older, it just balances out.
You're fret already.
No, man, don't fret.
Good to see you.
Good to see you too. Thank you so much.
And Robinson Fowler here with us, an iridologist. We're going to take a break. When we come back,